Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS Health 2.0 Europe, and joining me right now I have Zoe Griffiths. She is the Global Director for Nutrition at WW, which is formerly WeightWatchers. So Zoe, great to have you here with me.
Thank you for having me.
What are you doing at a health tech conference? Didn't expect to run into WeightWatchers here. What are you guys doing?
Well, our organisation is a health tech company.
It
We've been around for
become-
56 years, so
Yeah.
we have a long heritage, but absolutely tech and digital health is at the core of what we do.
I mean, we're in the middle of, everybody's calling this an obesity epidemic. I mean, and it's not just something that's US based or whatever, it's truly global. And in each country, the challenge is a little bit different. So what is WW doing now, especially, in terms of the new kind of rebranding, refresh? What are you doing to tackle obesity crisis at this point?
Well, unfortunately, there is an obesity crisis, and we're very much needed we're across 10 markets globally at the moment, but there's so many more countries that need a behaviour change company like ours to help them. And behaviour change is at the core of so many other chronic diseases.
Right.
So we support our members. We have just over 4.5 million members around the world, and we help them to eat healthier, to get more active, and have a positive and helpful mindset that can be applied to so many things. But being a global leader in weight management, what we're trying to do is to become a trusted partner in wellness.
Okay.
So we know that for so many, weight loss is the start of a wellness journey, but for others it might be different. And our goal is really to inspire people to build healthy habits for real life, and that's what we're about.
This is such an interesting space to me because there's so much going on, and even the words that you're using, it's like you're a behavior change platform and you're a wellness solution. It's like that's so different than what this was a decade ago. I mean, and I think like to your point, it's like this touches every aspect of life. So how are you, I guess, looking to make inroads where that line between wellness and healthcare kind of blur?
That's a great question. I think with our heritage and knowledge of what we do, what we're trying to do is to take our successful formula. So we are absolutely led by the best in science, but we also have rich insights, and we place our knowledge of consumers and our members and what they need and want from us together. And we think we can take that successful model from weight management to other areas of wellness to really help bring wellness to all and not make it just for a few.
What trends are you tracking, like personally in this space? Like, I mean, global head for nutrition for this big company. I mean, you've got to have your eye on like all the little apps and things, or all the different diets. Everybody's keto now. Like, what are you watching in this space? Like, what's hot right now for you that you're really interested in?
Well, not only are we looking at the stuff you might traditionally think that we're looking at, so of course nutrition trends, activity, but we are a behaviour change company, so what are all the new behavioural science that's coming out, and everything that people have in their toolbox. But we're also tracking great experiences, because our biggest competitors, people might think traditionally, are the DIY, do-it-yourself kind of weight loss programs, but actually our biggest competitors are people delivering great experiences that people want to join and stick with. So we're looking at, there's a lot of work to see what everyone else is doing, but also to listen to our members. We pay a lot of attention to our current members, people who have been members of ours before, and listen to them about what they want and need from us.
I'd like to ask too, I mean, about this change to WW and the fact that you guys do have such a long history in this space. Now is the moment to change, right? And I guess can you tell us a little bit about, I mean, from your perspective internally, what made this the moment, the year that, it was time to kind of, change the old model and shift it into more of this wellness behavior change approach?
So many things came together to mean that we went public with what we were trying to do. Last year we launched our Impact Manifesto that really told the world what we're all about and the intention that we have for our journey towards being that trusted partner in wellness. And so many things had come together. Our ability to launch programs and services, our tech capabilities have massively expanded, and our data science and use of that. So we're ready.
Right.
we're ready to do it.
Okay, and I want to ask, because I do have a lot of startups that watch me. I had the opportunity to speak with a startup that you guys have acquired called Kurbo. So I talked with one of the co-founders in another interview from this conference. So you had your eye on Kurbo. That was a childhood obesity engagement platform. What else is WeightWatchers looking at in the digital health space, or in terms of data science or things like that? Are there other startups that you kind of have your eye on, or certain areas where startups might be, able to knock on your door? Give us some tips here, Zoe.
Too much information, but we have a strategic growth office whose job and function it is to make sure that we know what's going on out there and that we're talking to exciting and impactful and science-based brands who could add to our experience and expand the markets that we are in, the engagement of our members, and ultimately what we're driving for is efficacy.
Yeah.
We want to be the most effective wellness programs out there, and so we're interested to collaborate with people.
All right, very cool. I know that's very exciting. We were very excited to see you at HIMSS Health 2.0 Europe. So thanks so much, Zoe, for joining me. It's a pleasure to meet you. This is Zoe from WeightWatchers, well, WW now. I'm Jessica DaMassa with WTF Health. Thanks so much for watching.